Hello and welcome to our Chapter 17 lecture. We are going to call this lecture Part 2, and we're going to continue our discussions on the exercise prescriptions for health and fitness. Now, we left off talking about prescribing exercise in order to improve our VO2 max. When we see that individuals have a low VO2 max, their intensity threshold for improvement is only about 30% of their VO2 reserve, whereas people who already have high VO2 maxes have a greater than 40 milliliters per kilogram per minute that is greater or equal to 46% of their VO2 max. So we mentioned in our Part 1 lecture that light to moderate physical activity is not going to significantly elevate our VO2 max. But for most people that have a range of exercise intensities that are associated with improving their VO2 max, they tend to have 40% to 89% of their VO2 reserve. That then translates to 50% to 80% of their VO2 max. Now, in order to help monitor our range that we should be within in order to improve our VO2 max, we can use something called our target heart rate range. And we can do this in two different methods. First is our direct method, where we are basically doing a direct measurement of our heart rate through a graded exercise test. And we've talked about this before. I believe it was in Chapter 4. And the second is through an indirect method, where we're going to estimate the max heart rate from a formula. So here are our two different methods. Our direct method, like we said, we need that graded exercise test so we can determine their VO2 max. Now, if you look at this graph on the right-hand side here, this is a 20-year-old subject, and their VO2 max was 12 mets. So you can see over here that we've stopped at 12 mets. And so if we take 60% of the VO2 max, we draw a line down and we could see that that's at approximately 7.2 mets, and at 80% VO2 max we are approximately at 9.6 mets. Then we are drawing lines going across here, and these horizontal lines are showing us our heart rate equivalents. So our range, let's say our target heart rate range, would sit between 138 beats per minute and 164 beats per minute. Now, our indirect method, like we said, is going to involve formulas. So we've got two different methods to do this indirect method. We have our heart rate reserve method, which is also known as our Karpinen method. And the second is to use a percentage of the maximal heart rate method. So let's do a little walkthrough of that heart rate reserve method. In order to do this, we are going to need to know their heart rate at rest and their maximal heart rate. So when we are able to subtract it, I should have put a subtraction in there, subtraction sign. There we go, that's better. So at the first number, we want that to be our maximal heart rate, and we subtract from there our resting heart rate, and that gives us our heart rate reserve. Now we want to compute what is 60% and 80% of that heart rate reserve, and then the answers of that, we would take those percentage of our heart rate reserve values and add it to our resting heart rate, and that would determine our target heart rate range. So let's go ahead and walk through an example of that. So let's say we have this subject. Their max heart rate is 200 beats per minute and their resting heart rate is 60 beats per minute. Now, if we do not have that person's max heart rate, there are ways to estimate this using these formulas here, such as 220 minus the person's age, or 208 minus 0.7 multiplied by the person's age. And there is some error associated with these max heart rate calculations. They are going to be about 10 to 11 beats per minute higher or lower than what they actually are. Anyway, so we do happen to have our max heart rate for this person. So our first step is to take that max heart rate and subtract it from their resting heart rate. And now we know our heart rate reserve, which is 140 beats per minute. Our second step is to obtain or calculate the 60% and 80% of that heart rate reserve. So what we do is we take 0.6, that's representing 60%, and multiply it with our heart rate reserve that we just calculated up here. And that gives us 84 beats per minute. If we were to compute 80% of that, we take 0.8 to represent that percentage and then multiply it by 140 beats per minute, which gives us 112 beats per minute. Now our last step is to take these two numbers and add our resting heart rate to it. So we've got 84, which was our 60%, right? And then we're going to add it to our resting heart rate, and that is going to give us 144 beats per minute. For our 80%, we're going to take that 112 beats per minute, add it to our resting heart rate, which is 60 beats per minute, and we get our total as 172 beats per minute. So now we know that our target heart range is from 144 through 172 beats per minute. That is the range we want to be in order to improve our VO2 max. And this figure here is really great because it shows us our heart rate reserve calculation that we just did in the previous slide, where we took 200 as the max heart rate and subtracted it from 60. This is our entire range of which our heart is able to beat within. So when we did our heart rate reserve method, we were able to see that our range should be from 144 beats per minute to 172. And then lastly, here on the right-hand side, we could see our second method, our second indirect method, I should say, which is the percent of maximal heart rate method. So in this method, we take 70% of what their heart rate max was. So basically, in order to calculate this, we would do 0.7 times 200, and we get 140 beats per minute. And then for the top end of that range, we take 85% of the maximal heart rate, and we get 170 beats per minute. So notice how this range is very similar to our heart rate reserve method as well. And so using this, we can prescribe our intensity of our exercise using this indirect method or direct methods. Some people may also predict the intensity of an exercise using the Borg scale of our rating of perceived exertion. And you could see that we've got this revised scale from 0 to 10, and you could see all the descriptions here on the right hand side. But here's our original rating scale, and that went from 6 to 12. So if we were looking at our Borg scale here, if we have our RPE from 12 to 17, that tends to correspond to about 40% to 89% of our heart rate reserve. And so sometimes people will use this scale as an adjunct to the target heart rate range in order to prescribe the intensity for healthy individuals. But it does take some practice of the individual, the subject, to be able to recognize which number they are on the scale as they're performing their exercise accurately. So here is a nice overview look of our exercise prescription guidelines in order to improve our VO2 max. For intensity, we are going to be between 40 and 89% of our heart rate reserve, or same percentage range for our oxygen uptake reserve. Or, as I mentioned in the previous slide, we're between 12 and 17 on that Borg scale. Now, in order to measure heart rate, we need to make sure we measure it immediately after we stop exercising by recording the pulse for about 10 seconds within the first 15 seconds of stopping that exercise. And we can use either the radial artery or the carotid artery in order to do this. Now, most of the time we have fancy devices such as watches or bracelets or heart rate monitors that we can use. But depending on what device you're using, the accuracy can be variable, but there are many devices that are pretty accurate at measuring heart rate. Now let's move into duration. The ACSM is going to recommend that we have about 20 to 60 minutes per exercise session, or I should and say that it is a aerobic training session. And within this duration, we can aim to improve our VO2 max, but it does depend on our intensity. We have to match it up with that in order to see improvements on our VO2 max. And lastly, we've got our frequency. We want to do that for at least 3 to 5 days per week or more. Continuing our discussion on the duration piece that we were just talking about, so the 20 to 60 minutes, there was a study that was done to kind of look at this in order to see how we can improve our VO2 max. So this study had 4 experimental groups. There was one group, which was our control group, that did absolutely no exercise, and the 3 other groups performed about 50% of their VO2 max, so we could say moderate intensity, at different durations. So we had 72 minutes per week, 136 minutes per week, and 192 minutes per week. So what we saw is as we started to increase the duration, we saw improvements in VO2 max. And you could see that this happened the most, because our slope is the greatest here, for people that went from no exercise to doing at least 72 minutes per week. Something else the study found was that sedentary people were really good at performing low intensity exercise for long periods of time, but they were not the best at doing high intense exercise for short durations. So starting off at a low intensity might be better, especially if they are starting at the sedentary level. So what you may have gathered by now is that measurement of our VO2 max is the gold standard for describing fitness levels in adults. And we could see this in table 17.2. So I'm just going to speed on over to this table here. And we can see that this is divided based on the person's biological sex as well as their age. And so within these numbers here, there is a percentile. And if we have someone that is within the 5th percentile, meaning they're comparing them to the population nationwide, they fit within this 5th percentile, which puts them at very poor fitness category, and they are at risk for coronary heart disease. This very poor fitness category ranges from 5 to 15. So if you fit along here, you definitely want to start exercising and see your doctor regarding your cardiovascular health. If you are in the 80 percentile category, you are said to have an excellent fitness category and are not at risk. And of course, the 95th percentile is the highest, and so that is going to be our superior fitness category. Let's go back one slide and visit this estimating VO2 max from a sub-maximal exercise test. If you remember in this test, we start the person either on a treadmill, or it could be a cycle ergometer, in which we are increasing the work rate. So this can help us estimate the VO2 max because of the linear relationship that we see with our VO2 max and our heart rate, which we see here on the y-axis. So using this submaximal test, we can see that the subject reaches about 85% of their heart rate max, and they stop the test. But what we could do is kind of draw in this linear relationship and continue to estimate where their maximal heart rate is. And in this case, it is 200 beats per minute. We can then take that point and draw a vertical line down and see that their VO2 max is going to be 2.7 liters per minute. Of course, we would have to pull in their weight in order to get an accurate VO2 max at that point, because there is no kilograms factored into this. Next, let's talk about strength training. Because we have health benefits associated with resistance exercise training, our physical activity guidelines recommend a program of strength training combined with aerobic exercise for health. So what are we aiming to goal for? We are going to have our major health-related goals, including an increase in muscular strength and fat-free mass, an increase in our resting metabolic rate, as well as an increase in our bone density. And so we can look at this table here that shows us the effects of aerobic exercise alongside our resistance exercise on health and fitness. So I won't go through and read through all of these. Just a couple things to note though, that we do see with total body fat that will have more of an impact with aerobic exercise compared to resistance exercise, whereas anything such as muscular strength, mass, or power will of course be affected more through resistance exercise. Something else to pay attention to is our insulin sensitivity. You can see that both aerobic and resistance exercise helps to improve that evenly. And lastly, I'll point out that our aerobic exercise is going to be able to affect our VO2 much more than our resistance exercise. And we also can contribute that to the increase in our mitochondrial volume as well as our capillary density. So how much should we be doing our strength training? Here are our guidelines. We want to be able to do free weights, machines, or bands and perform about 8 to 10 multi-joint exercises that would stress all of our major muscle groups, although studies have shown that if we do single joint exercises, that is going to give us good results as well. And we want to perform about 1 to 2 sets of 8 to 12 reps with good form. We can lift and lower the weights in a controlled manner, about 2 seconds up and down, and then our last rep should be the most difficult to complete, basically fatiguing our muscle. And we want to do this about 2 days per week, but of course more is better. And we want to make sure that they are non-consecutive, meaning that we have a rest day in between our sessions. And if we gradually increase our weight that we lift over time, we will see greater strength gains. And the last thing we'll talk about is the way that we can improve flexibility. Flexibility is our ability to move that joint through a normal range of motion. So we can do this using a goniometer, which is going to allow us to basically have these 2 rulers in which we have a starting or origin point, and then we rotate a limb around so that we can see the angle at which we have our range of motion. So when we do stretching, we can have several methods. One is going to be static stretching. That is going to be our most effective method. And this is performed by relaxing our muscle, following by holding the muscle in a stretched position. So how often should we be doing this? About 3 to 5 days per week. Our intensity is to stretch that muscle to the point where we're slightly uncomfortable, but we don't want pain to be taking place. Duration should be to do this and hold for 15 to 30 seconds, and repetitions should be 3 to 5 of each of the stretches. And our volume should be a total of 60 seconds or more per muscle group. So that is it for chapter 17. Please let me know if you have any questions.